Hi, everyone, and welcome to the 2025 Healthcare AI Bootcamp presented in collaboration by several Telehealth Resource Center partners, a Telehealth Center of Excellence, and many other partner organizations. My name is Lydia Katowski, a policy analyst with the California Telehealth Resource Center, and I have the pleasure of moderating today's event. We're so glad you are joining us on this AI journey for our bootcamp's first live session titled Foundations: What is AI? Before we begin, I'd like to go over a few tips to help you navigate the webinar. Next slide, please. If you can use the Zoom functions to ask questions, post comments, and connect with fellow attendees. We will be reserving time for Q&A at the end, so we would love to hear from you via the Q&A function. This session is being recorded and will be posted on the AI Bootcamp YouTube channel by the end of the month. If you encounter any technical issues, please reach out to a member of our team on the platform or contact us at contact@healthaibootcamp.org. Next slide, please. We would like to thank the Department of Health and Human Services for funding many of the partners that helped make today's event possible. We do want to note that the funding does not constitute an endorsement of any information or content by the U.S. government, and that conclusions are those of the speakers. The information and tools presented are intended for general information purposes only and are not intended or implied to be a substitute for professional legal or billing advice. All materials are strictly for informational and educational purposes only. Next slide. Just to note that you do have to register for future sessions to stay on this learning journey. So if you haven't already, we'll drop a link in the chat and we hope to see you at our other sessions later this summer. There will be 2 virtual sessions in July, followed by hybrid sessions in August. We'd also like to thank all the organizations that have helped make today possible, as well as those upcoming sessions by sharing their expertise and resources. You can see all of those involved in the planning and execution of this event on the slide. Now it is my pleasure to introduce the 2 wonderful speakers who are here to kick off the 2025 AI Bootcamp. Next slide. Jordan Berg is the principal investigator at the National Telehealth Technology and Assessment Center. He has over 16 years of experience working in health IT and helps lead telehealth evaluation and adoption efforts. Dr. Elizabeth Krupinski is the director of the Southwest Telehealth Resource Center and the vice chair of research at Emory University in the departments of radiology, psychology, and bioinformatics. She has expertise in medical image perception, observer performance, decision-making, human factors, and the interface between humans and computers, and how that impacts clinical decision-making, efficacy, and efficiency. And with that, Jordan, I will hand it over to you to get us started.
All right, thank you. So our presentation is going to have 2 parts today. So I'm going to take the first part, which I think is the easier part, but you're going to want to stay attuned for the second part from Dr. Krupinski. She has just so much great insight, and in fact, if you already know everything about AI, you need to come back for hers, but now might be a good time to grab a little cup of coffee or something. But we're going to run through a lot of information for you today, but at a high level, we really want to address what is AI, why does it matter right now, what are some of the underlying technologies that we need to think about and consider as we're kind of beginning this AI journey. And then what are some of the things that we should just be aware of and some of the challenges that we expect to see in the space. So next slide, please. I want to declare I don't have any conflict of interest to report. It would have been nice if I would have invested in a bunch of these companies that are being invested in so heavily right now, but that's not the case. And I have no problem with that because it lets me talk about them. Next slide, please. All right, so our objectives today are to, number 1, introduce some artificial intelligence concepts and terminology. We're going to explore some of artificial intelligence role in our current technology transformation cycle, where we're going to talk about some of the fundamental technologies that are really enhancing AI. And we're going to differentiate between some of the AI methods and systems types with the goal of really understanding that there's so many broad technologies that are being used together to create the AI systems that we see. And then we're going to identify key applications for artificial intelligence in managing chronic conditions. Next slide, please. So, whenever you're speaking, you're supposed to appeal to expertise. And in this case, you guys are the experts. So you guys filled out a survey as you registered for this webinar. And I really wanted to get my hands on it and really get a sense from you guys as to where you felt your understanding of AI was, and some of the things that you were interested in learning and becoming more aware of. And I was really excited to see just the disbursement of different places and different spaces for you guys as you're approaching AI in healthcare. There's a wide variety of you that have never used AI in healthcare, don't kind of really understand where, or just maybe coming to the topic. Some of you that are aware of it, and I find this is a lot of people. There's a kind of a shrug factor, like, hey, I know this is important. I don't know why this is important. I don't know what its impact is going to be on me, but I can feel it coming. And you know that if that's you, you're in a good spot. We'll be sharing a lot of things that will be of real help and useful for you. If you feel like you can explain basic AI concepts, that's great. We'll hopefully help you to apply some words and some phrases that you can actually use to really kind of narrow down what your goal and your scope of your AI applications are. And then we're definitely going to be addressing some understanding of risks and benefits. We're going to help you guys as you've been learning about this, and then really hopefully give you some practical tools that you can use to deploy and institute AI in your practices. Moving on to the next slide, please. So I wanted to talk a little bit about why AI matters. And the fact that you're here means that you already have at least some understanding that AI is important, and it's kind of changing things around us. But maybe maybe there's some benefit in kind of us explaining why these things are happening and what are some of the driving forces behind AI. So there's kind of two main things that I want to talk about here in the space. Is one is generally about AI in general, and one is about AI specific to healthcare. So what we're seeing is that AI right now is experiencing a little bit of a moment. And why is it experiencing in this moment? Well, it's because of a convergence of a few different things. The first, and I always like to lead off with this, is there is a lot of hype around AI, and there is a lot of discussion around AI, and not all of it's beneficial, and not all of it's completely actionable. So hype does exist, and we'll talk about this a little bit later. But why? Why is everybody talking about this? Why is everybody so engaged? I think some of this is based on the accessibility of the AI tools that we've seen, especially with generative AI and the chat bots that we've been able to engage with. Everybody has had, or pretty much everyone is having at least some ability to interact with some of these AI tools. And, they've kind of surprised us, right? Like, oh, this is maybe better than I expected it to be. And it's kind of fired our imaginations. Or maybe it's given us a little bit of apprehension, like, well, my job is to, do this and to do that. And I'm concerned about maybe AI doing some of the things that I can do in a way that I do them. So like there's a lot of, and because of that, because of the accessibility and that interest to the general public, we've had a lot of media attention. We've also seen that it's AI being used as a sales and marketing tool where, if you have a basic algorithm in your application, well, let's call it AI because, we know that that's a buzzword and that's a term that people are engaging with. So, so there's a lot of AI, the usage of AI in marketing and sales where maybe it's not actually AI, or maybe it's a limited form of AI. And that one of the things that we're going to talk about today is that there are a wide variety of different technologies that come together to make up what we call artificial intelligence, and we should be aware of that. But underlying the hype, and there is a lot of things that have actually happened to improve the abilities of artificial intelligence to really make an impact on our lives. Some of those are, we've seen a massive improvement in our ability to process data. A lot of this has been around improvements in general processing units, but we're actually seeing a rapid race to create more and more AI-specific processing chips that can actually process the data that neural nets need in a way that really is useful for them and is most efficient for them. So we're seeing a lot of hardware that's actually improving our ability to do the processing. Paired with that, we've seen a rise in cloud-based storage and access to cloud-based vast amounts of storage that we can actually use to house data sets, that we can actually use to house applications. And that's really made these tools a lot more accessible, these libraries and data sets a lot more accessible. Finally, we have an increase in our ability, our networking capabilities. So with the increase of more broadband, more connected users across the globe, we're able to actually access these tools, access these resources from anywhere in the globe and set up these storage pretty seamlessly and with minimal amounts of effort. So those are kind of some of the underlying technologies that are driving this AI moment. And finally, is we can't avoid the fact that AI, the capability of AI itself, and a wide variety of tools, some more than others, and we'll talk about that as well, is increasing at a rapid rate. So the things that the things the tools are doing now versus the things that tools were doing even a year ago, there's a market improvement in the ability of these to be accurate, to be quick, and to be helpful. Next slide, please. So on the more specific side of that, let's relate this back to healthcare. So we've got this tool that's growing in capability, and then we have a healthcare system that's in crisis. And so we have kind of an inflection point between what's happening in healthcare and what's happening with AI. And if there's a way for us to continue to merge these two things together, we have a potential to create some solutions to some of the crises we see. I am not going to belabor this point very much, especially the first 2 points here. I think we can all acknowledge that we are seeing the impact of shortages throughout the healthcare sector. And it's not just clinicians, but it's also administrative. Pretty much at every single level of our organizations, we're seeing this impact of workforce shortage. We're also seeing aging populations. We're seeing a lot of providers and a lot of individuals that have experienced burnout and work stressors, some of that from the public health emergency, and some of that just from the fact that there's just fewer and fewer people trying to do more and more work. On top of that, we do all can acknowledge that there's been increased demand. We're especially seeing increased demand for chronic disease management, for behavioral health, and these things are beginning to overwhelm our already overworked healthcare workforce. The third topic I want to spend a little bit more time on, and that is the rise in data proliferation. So healthcare data is the quickest growing data sector in the world. So we are adding more and more health data to the overall volume of health data at a exponential rate. It's increasing rapidly. And the tools, individuals can't really process all this data. But some of this is coming from our electronic medical records. And a lot of this, an increasing amount of this, is actually being generated by patients themselves. And this is a kind of a new space for us. We're seeing a lot of data that's being generated by mobile devices, by monitoring tools, and by systems that the patients are engaging with on a day-to-day basis. And it's giving us this valuable but vast amount of data that's highly varied, highly unstructured, and so these are all things that we're having to deal with in the healthcare system. Next slide, please. So how does this tie to AI? Well, we're going to talk about this a little bit, but AI is uniquely designed to address some of these challenges that we've seen. But before we get too far into this, one of the key things that I want you guys to take away from it, from our discussion today, is just kind of how vast of a topic this is and how varied the different tools are that we're seeing actually being used in systems. I wanted to start with a very general definition of AI, and then we're going to move to a more healthcare specific version of definition of AI. But I actually really like the Wikipedia definition of AI, and so there's the other thing that we know is there's a bunch of definitions that are floating out there. And so for our general one, I just chose the Wikipedia one because I think it hits on a couple key things. So artificial intelligence is the simulation of human intelligence processes by machines, especially computer systems. These processes include learning, reasoning, and self-correction. So that's pretty straightforward. It's AI simulating how people and individuals process information. Moving on to the next slide, we can actually see key definitions for healthcare AI. So you'll actually see, yes, we're simulating human intelligence, but the intent of what we're doing is different for healthcare. Our intent when we use AI is to improve healthcare delivery, improve patient outcomes, and increase administrative efficiency. So the tools we're using are the same. The intent behind the tools are very different, and the amount of risk that we're willing to take to care for our patients, we probably have a very different risk profile than a lot of other organizations. Next slide. So at the end of the day, what AI is it's kind of a bridge between what humans are good at and what machines are good at. Humans are good at empathy. They're good at complex decision making. We're good at chewing up the meat and spitting out the bone, perhaps, like just being able to take vast amounts of data and intuitively looking at it and saying, like, this is important, this is not. What are machines good at? Machines are good at doing repetitive tasks very, very fast without getting tired. AI kind of bridges the gap. What if we can add some of that human level reasoning and pair it with the ability of machines to do tasks rapidly over and over and over again without getting tired? Next slide. So throughout the boot camp, you're actually going to see this framework used over and over and over again. What we're focusing on today is this first four categories: systems, methods, functions, and levels of autonomy. So the first four sections of this framework are concerned with how AIs do the jobs we give them. What are the underlying data methods, algorithms, and technologies that we use to create usable systems? How do we take those systems and get usable functions that we can actually deploy into our work? The bottom four are concerned with how are we actually integrating these systems into the workforces and into the organizations that we have, and identifying what levels of trust and autonomy, how are we going to engage with these systems. Next slide. So when we're talking about methods and systems, let's talk about this a little bit. So AI methods and systems in healthcare, and you'll notice a giant asterisk behind that because this is by no means an anyway a complete list. There are tools and systems that are being deployed. There are tools and systems that are being worked on now that are much faster than we could put into the list here. But I wanted to kind of just line out a few common methods and what kinds of systems those might be in. So these range from things like expert systems, which are limited AIs that are trained on a very specific data set to do a very specific job. So for example, you might have a pharmacy expert system that has all of your pharmacology encyclopedic knowledge that is specifically looking for drug interactions. And it can hold way more knowledge than a human pharmacist brain could and can help flag and alert towards potential problems. What if you had a system that was completely and trained on the Medicare claims processing manual that had an encyclopedic understanding of all of those billing and coding regulations and how they interacted, and was specifically designed to do that job? Those are examples of expert systems that we could employ. Predictive models are designed to see data coming in and then create a plan or create a risk assessment on what we might see as outcomes. So we get data in and then we forecast the outcomes. So what might we do with a predictive model? Well, we might use it to predict 30-day readmission risk. We might be able to use it to identify patients that might have a higher fall risk and be able to take mitigating efforts to keep them safe. We might use it in our remote patient monitoring, collecting all of that data coming in and being able to do trend analysis at a deeper depth and at a broader scale than what we can do at human levels. Generative AI is kind of one of the technologies that's captured a lot of the imagination of the public. This is tools that actually create content from whole cloth. So it creates digital resources. For example, AI listening in on a patient room might be able to do a chart summarization, or might be able to help provide scribing for a provider and create insights within the patient's medical record. We're going to talk about computer vision a little bit more here lately, but this is the ability of computers to see, visualize, and recognize the difference between two different images. This is a high level of AI systems have a high level of capability in the space. Computer vision is one of the most developed areas of AI and is actually being used to great effect in a lot of different applications. So we see this in skin cancer detection, diabetic retinopathy screening, lab results, wide variety of applications. And Dr. Krupinski will be going into some of that in a little bit more detail. And then conversational AI. So this is a type of generative AI, but it's designed to engage humans in the way that we're most used to interacting, by talking. So these could be triage chatbots or chatbots that are used to collect billing information from patients. These could be therapeutic chatbots, so that are designed to provide low levels of therapeutic talk therapy, or be able to assess a person's mood by conversations that they're having. So we'll go ahead and go on to the next slide. Within all of this, and again, you're going to see some of the technologies here described, we need to be thinking about what is the level of risk that we're willing to take on with these tools. And we can do that by assigning some categories of AI autonomy. And three useful categories of AI autonomy that we want to consider are assistive. So those are technologies that work beside the provider, that are there to enhance the ability or to provide information to the provider that they need, but they could potentially get on their own, but are just an assistive tool to the provider. And they're working very much in partnership with the provider. Augmentative technologies, which actually increase the ability of the provider to see details that maybe they couldn't see, or to flag information that maybe was hard for them to process. And finally, we have autonomous tools that perform tasks independently without human insight or without human interactions. And these autonomous tools, we do see robotic tools in surgical processes, but a lot of these are kind of in the space of science fiction for the most part, in many different ways. Although we have seen tools that are able to capture images, compare them, and actually produce outputs completely on their own with a high degree of accuracy. Next slide. So we're going to go over these slides here pretty quickly. Where are we at with the AI journey? There's a lot of hype. The Gartner hype cycle is one of my favorite ways to talk about this. But I'm going to go to the next slide. We're going to see this in a much more condensed form. So the whole point of this diagram is we expect any technology that comes to change everything and to make things way better. And that's that peak there. And then we realize that it's not going to fix everything. And then that drops us into that trough there. And then there's a point in time where a technology becomes accessible, usable, within just some well understood and kind of we call it the plateau of productivity. When is this tool actually useful? And if we look at this, a lot of the AI tools are still at that peak of inflated expectation. They're still at the height of the hype. But we do see some tools that are moving towards that plateau of productivity. And one that's really firmly in the plateau of productivity, and that's computer vision. That's the ability of a computer to look at a bunch of different images and to tell you, like, we think this is this, or within a degree of probability, this is what we're seeing in this picture. And we just want to point this out that, like, there's a lot of different AI technologies out there, and not all of them are created equally. The next slide, please. So we're about right on time for where we're supposed to be, but I want to really reinforce what are the three key takeaways that I want you to have in your mind. One is that AI is really, hype withstanding, is really set to be a transformative technology for healthcare, for the different things that we do. So it does have the ability to change the way we care for our patients, change the way we care for our employees, change the way that we really do a lot of the things that we're doing day to day. But it's also important to note AI is not just one thing. And whenever someone just throws AI without some sort of qualifier as to what is the underlying technology, what is it doing, you should be kind of concerned that you might be getting a sales pitch, or you should be kind of concerned that that you don't understand the scope of what the tool is that you're using. The third thing is AI systems need jobs, and this is not some sort of call for AIs to take over the roles that we do, but what it is a call for is we really need to be specific, and we really need to understand the environments, the tasks, and the outcomes that we expect from AI tools. So I had AI generate this image for me. We want AIs to have IKEA-like experiences where we give them really good paths to get the results that we want, that we understand the roles and the responsibilities that we expect them to take on, and that they have clear outcomes for success. And so those are the three key takeaways: that we understand that the technology is transformative, we understand that it's a broad variety of different technologies that can be used and combined in different ways to create different results, and that we understand that these are tools that we need to make sure we can guide and give guidance to really use them successfully. And with that, I'm going to turn it over to Dr. Krupinski.
All right, Jordan, that was awesome. And thank you for kind of setting me up. And one sentence in particular that I'm going to play off of was one that you used on your almost last slide, which was, there's a lot of AI systems out there, but they're not all created equal. So that's a little bit about what I'm going to delve into and try to get new perspective on things, perhaps. As a user, what do you need to be aware of? And what are some of the things that you should be asking, I guess, to some of the vendors who are there trying to sell you things. So next slide. Again, I have no conflicts of interest to report either. Next slide. So Jordan went over the objectives, but what I'm going to do is go over some from a slightly different angle, which is to identify sort of the differential risks that are associated with AI systems, applications, when you deploy them. And then really, is there, the role of bias across how and when people develop these and all the way through you as a user, how you're going to possibly encounter biases then and how that can really become an important factor. So next slide. This is a really great illustration that came from the FSMB, and it talks about sort of the risk to patient safety as a function of the practice of medicine, and where do all these types of AI tools kind of fit in along this, also the regulatory accountability line there that's going up from the lower left to the top right. And as you can see, there's sort of, the administrative tasks really that are utilizing AI a lot these days, and you probably don't even realize it. Same thing with documentation, scribing, and data collection. A lot of this stuff kind of goes around in the background, and you're not even aware of it. Less risk to the patient and less sort of involvement in the actual practice of medicine. And there's really not a whole lot of regulatory accountability there. As you get closer and closer to that top point of clinical decision support, which is where you've got the true practice of medicine, but also the greatest risk to the patient, that's where you're getting more and more regulatory accountability. I don't want to go into sort of the whole regulatory aspects of it. That'll come at a later date. But just be aware that there is this interplay between these three variables: the risk to patient safety, the practice of medicine, regulatory accountability, and the type of AI systems that are being used and developed. Next slide. Next slide. Next slide. I didn't realize they were going to come up as a thing. So we're going to have a poll now. So get ready to answer things. And the question is, what is brittle AI? So if everybody could go into your poll answer function. And so far, we got a couple answers here. I'm expecting the full 226 of you to provide answers. A couple. A lot of different ones. Kind of slowing down here. All right, well, it looks basically like that the second one, AI is highly specialized and works well in narrow conditions, but fails in unfamiliar or slightly different situations, is most people's answer, followed by AI systems that perform well in unpredictable real-world environments, but crashes on easy problems. And then AI system capable of emotional reasoning designed to snap or go crazy when overlaid with empathy. And there's some of you who have a sense of humor, and it's an AI framework named after a famous candy maker that sticks well together. So let's end the poll. And next slide. So what is it? Well, it was the one that most people got. And the problem is that all AI models have to be trained on something, some sort of data. And a lot of them that are out there are really trained, tested, and validated using rather limited data sets from very specific populations or environments. And by environments, I mean, for example, an academic medical center, which is where a lot of the data comes from, versus a large set of private practices or FQHCs. Different equipment. We all have there's different stethoscopes, there's different MRIs, there's different dialysis machines, different companies make them. And every one of them operates in a different way, provides data in a different way, and thus you could potentially end up with these models that don't work well when you transfer them to other things. And processes as well. Everybody has a different way of doing things. And the result of all of this, when you get these brittle or fragile AI systems, is that every company is going to come out and they're going to advertise and they're going to publish specific sensitivity and specificity rates. Actually, a lot of them are going to give you accuracy. My best advice is beware of accuracy. If they're presenting just accuracy data, go back and ask them. I want to know the sensitivity and the specificity. In other words, what are the true positive rates and what are the false positive rates? Because accuracy can be very misleading sometimes. And if you don't account for the limitations or these biases in all your data when you're developing these AI schemes, they will be brittle. So when you get a scheme that was, for example, developed, validated, and tested on a bunch of data, say from Emory University, and then you want to take it to your FQHC and have it work the same on your population of patients, it probably won't. It will drop in performance, and guaranteed that is almost always going to happen. And that's because you've got different types of data going into the system than it was originally trained on. Now, one way that you can practically address this is request from the company that's trying to sell you this AI system, ask them for a shadow deployment. And this is really good for any new products. And actually, when you're going to do an upgrade on an existing product, you want to do this as well. And essentially what you do is you run it in the background and look at all the possible cases that it's going to encounter using your data. And ideally, they're going to do this for free. Because they have enough confidence in their system, hopefully, that when it does go to your system, it's not going to have this lower performance in your environment, or at least not a significant one. So ask for a shadow deployment, and whether it's, you got to make it long enough to get some real data and to encounter all the possible range of cases that you have. 3 months, 6 months, and then, if you like it, then you buy it. And if it never increases in performance or reaches the level of performance that you expected, then you don't have to buy it. So be aware of brittle or fragile AI and the utility of shadow deployment. Next slide. And this is why accuracy is a problem. So suppose you've got, some AI models and, here's some data that you're putting images in, and you've got a bunch of images of cats and dogs and vehicles and stuff. And now you want to classify this image into which group does it belong to. So next slide, or hit. Okay, one system tells you that this lovely looking little pussycat here in the grass is really a truck. Next slide. The other one says that it's a dog. Now, both of these actually have 98% accuracy. Okay, but they do have some false positives and false negatives. So which model would you prefer as a provider? Well, I honestly would prefer the one that at least classifies as the cat as a dog. At least it's another animal, it's furry, it's sitting there in the grass. That is potentially a false positive or a false negative I could deal with. And if it wasn't a cat and a dog, what if you're trying to decipher cancer versus, say, diverticulitis? So these are the types of questions and why I think accuracy is not very good, and why you really should be thinking about sensitivity and specificity. Next slide. So some biases, and these are just a few of very, very many biases that can happen in the AI world. And this is throughout the system. This is from the development, through the training, through the testing, through the validation, and then translation into clinical practice and use. One of the ones is data bias and representation. And I already talked about it, but in a little more detail, it really is due to imbalanced or incomplete data sets. No data set can incorporate the vast range of diverse populations. And so what happens is the resulting, the diagnoses, the treatment recommendations, the course of care, whatever the tool does, for the groups that are not accounted for or underrepresented or not even there, they're going to mess up the AI schemes and they're going to potentially fail. Now, one way to fix that, of course, is to provide it with diverse and representative data sets. And there's also something called fairness metrics that are being investigated now that you can incorporate as well. The problem is, of course, that it's really hard to get these data sets. And even when you think about, AI schemes that have been trained on tens of thousands of data points, that actually may not be enough. Again, human bodies, human disease, and so on, there's just such variation that it doesn't always come across in the data sets. There's also sociocultural biases. If AI basically inherits the biases that we have. So if there's existing biases in the training data sets, in other words, for example, you got a data set and it's all based on, white middle-aged men. Well, then your AI scheme is going to have those biases as well. And the outputs that it propagates are going to have those biases. So when you try to apply that AI scheme to, a young African-American woman, it is potentially going to fail because it already is biased before it even gets out of the box, basically. You can fix that again by retraining your data, your AI with diverse and unbiased data, and try to include culturally relevant experts in this system to help you identify what is absolutely relevant. There's also something called feedback loop bias. A lot of the times AI recommendations, when they're consistently followed, so the providers that's what the AI says, well, that's what I'm going to do. It may reinforce existing biases. If the AI system is biased and then the provider listens to it, it propagates those biases as well. And it's just this feedback loop that you kind of get stuck in. And the way to fix that one is to try to think independently and critically. Sit down and say, well, why would the AI say that? What kind of information had that? If you need, get second opinions. Find another provider and say, hey, does this seem right to you? And then there's something called algorithm transparency that hopefully an AI developer will provide you with as well, and kind of explain what it is that the system really is looking at and what's it doing with it. Next slide. There are a lot of areas where there are existing studies showing how a lot of these AI schemes can be biased. And a lot of the time, it's really easy to see it in imaging data. And imaging, that's radiology, dermatology, ophthalmology, pathology, and so on. And there's been all these studies that have confirmed that AI can leverage demographic shortcuts when they classify diseases. So, for example, if you give patients or give the AI images and clinical data from the EMR, which perhaps includes a zip code, the AI system can actually, just based on the image and these data, don't even include information on race, gender, age, and so on. The AI system can, just because of the zip code, in a good percentage of the time, far better than chance, assess and get the race and often the gender and age of the patient correct, simply based on other pieces of data that you would think, how could that even be possible? And so this team has developed ways to get at fairness in algorithms. So this is just a great study that was done, and it can reveal why models can be biased. So if you're interested in that, and it's kind of not applies to just imaging data, but all of medical data as well. So what happens when you move from the lab into the clinic? Biases, and this just kind of illustrates some of the ones that are very surprising, and also gives you some of the ways to avoid some of those biases. Next slide. Other biases, towards younger people, towards older people. There's linguistic biases, for example, in ChatGPT, that are reinforcing dialect discrimination. And again, a lot of the AI schemes out there had this huge potential to perpetuate healthcare disparities, simply because the data that we're feeding them is biased. And there's a lot of literature on this, a lot of studies that have made fairly high profile news stories and outlets. And so just be aware that these exist. And when you've got an AI scheme, make sure that when it's operating in your system, you at least are aware of potential biases so you can catch them if they start to occur. So next slide. We got another poll. So poll, this one. How many types of cognitive biases do humans have? Again, we got some good distribution of people answering in all 4 or 5 possibilities. People have to think less on this one, I guess, because we're already close to 150. Way up there. A little bit going. The correct answer is more than 100, and it looks like just under half of you got that one with about equal distribution in the other 4 categories. So yeah, we are prone to biases, and there's well over 100 of them. And as you can see, like I said, about 48% now are actually saying that it's over 100. So that's awesome. Next slide. This is a great diagram of all the cognitive biases, and probably not even all of them. And you can see exactly how many they are. And it's somebody did this and kind of compiled all the cognitive biases from the literature. The inner circle there, and it's all in fine print, but if you want to go to the website, it's great. That shows exactly how many are. There's hundreds of them. And this person did a really good job of kind of condensing them into 4 basic categories, what should we remember, too much information, not enough meaning, and we need to act fast. And some of the things that as they apply to AI and AI use is, 1, we discard specifics to form generalities. And in a sense, that's what AI can do as well as what humans can do. That we tend to, if the AI is going to give us a general answer, we may go with that one rather than trying to get into the specifics and the weeds of everything. We're drawn to details to confirm our own existing beliefs. So if I already have a preconception, or the AI has a preconception about what something is in an image or in some data, and the AI sort of confirms what I was thinking, I'm just going to go with that. I'm not going to be as much of a critical thinker. People like it when the AI confirms what they were thinking in the first place, and don't really pursue it and say, is it me? Is it them? Are we both really right, or are we wrong? We also tend to simplify probabilities and numbers to make them easier to think about. People are notoriously bad about numbers and so on. And if AI is something that's going to provide answers in terms of simple, easy to read numbers, again, it may be something that we prefer to think about, or it may bias our responses. We also favor simple looking options and complete information over complex and ambiguous options. So we can't have an AI system that's sort of like a radiologist that's hedging their bets all the time and putting ambiguities. We would want and prefer an AI system that's give me the answer and make it short and sweet, because otherwise it can really bias our responses. So AI systems that are too complex, that provide too much information, get too far down into the weeds, and confirm what we're already thinking, they may not be the best ones to. And the key here is be aware of what your biases are, and when you're using AI, make sure it doesn't perpetuate your biases, or you don't perpetuate its biases. Next slide. Can the form, this is a study I did, and the question is, can the form of an AI feedback, how it presents that information to the user, actually impact efficacy and efficiency? So kind of hit the space bar and continue through this. So the study basically looked at chest images with COVID and presented 4 different types of cues. 1 simply said a word. It's moderate. It's COVID. It's moderate in their severity. It could be mild, moderate, severe, normal, moderate. Second form of AI was a probability graph, providing numbers. The other one was a heat graph. Looks really cool. It's pretty. And then the last one was a heat graph plus the probability graph. And interestingly, the AI was finding the same thing. All we did was change the way the information is presented to the user. In this case, the best one was actually the final one, where you had the heat map and the probability graph. It did take a little bit longer, though. So AI helped impact decision efficacy. It made the decisions better, fewer true positives and false positives. But it also took a bit longer. The one that they really liked was when the AI said a word, normal, when they already thought the image was normal. They didn't really like the probability graphs, because as you can see, there's 2 choices there. It thinks, well, it could be moderate, could be severe, and it's about a 60-40 chance. People don't like that ambiguity. We prefer just a single number, yes or no, or the heat map in conjunction, which kind of shows where and why the AI system is impacting or getting its information from. So actually, we have to be aware of how we present AI, whether it's with images, whether it's with any other type of decision support, because that actually impacts how that information is used. So next slide. I would also like to make a plug for AI explainability. And again, I'm just going to use an image-based example. In radiology, like I said, there's the heat maps, and all the heat maps really show, and they're really cool to look at, and they got all these colors and stuff, but it just shows which pixels in an image, and it could be ophthalmology, pathology, whatever, which pixels did the AI scheme use to render its decision. To be perfectly honest, that's absolutely useless to a clinician, because quite often the AI is picking up on pieces of information that the human visual system can't even see. And so showing me the pixels that it used is absolutely useless. What I would like to argue for in explainability, and what you should start to look for in AI schemes, is it truly explainable? In a sense, can I take information that the AI system can glean, whether it's image information, data information, whatever, and transform it into something that the human can see, that is within their visual system or their auditory system, if it's looking at stethoscope and heart sounds, for example, or lung sounds. It's got to be something that the user is already used to. So we can't present things in ways that it's no use to say this image has potentially pancreatic cancer if only the AI system can see it. Because if the radiologist or the surgeon can't see it, they can't do surgery because they don't know where it is. They can't do chemo. They can't do radiation therapy, again, because you don't know what it is that the AI is really seeing. So AI explainability should not just be explaining what the algorithms do. Next slide. Another example is a problem that I see is something called de-skilling. And everybody used to be able to read maps, get from your house to the gas station to 500 miles away, and you do it by reading maps and so on. GPS took away all that. People have very little ability to use maps or actually pay attention to their environment. And what we've seen is that GPS reduces memory building, and AI in general has a huge potential to do that. And I think it greatly impacts our learners, our medical learners. It also is going to impact our professionals now, because if the AI takes over a lot of the skills and does things for us and process the information and simply spits out answers without good explanations, potentially we are de-skilling our users, and that could have potential harm for them as a profession, as well as an impact on patient care. So just be aware, de-skilling is a possibility. Next slide. Just information. This all comes from the field called cybernetics. And if you want to read a really good book, Norbert Wiener actually introduced the term cybernetics back in 1948. And it was all about the scientific study of control and communication in the animal and the machine, the animal being the human. And how do we create systems that integrate and are synergistic between humans and computers? AI cannot be a peripheral. It can't just be sitting out there to an existing legacy IT systems and workflows. We have to figure out how to get agentic AI workflow orchestrated in the environment to leverage human-machine real-time collaboration. And we're not there yet, but this really is where the future of AI in healthcare really should be. Next slide. I think we're up for questions now.
Great. Thank you so much, both of you, for such educational presentations. I've had the pleasure of speaking with both of you previously, and I learned new things today. So really, really appreciate your time and expertise. We have had several questions come in from our audience, two both dealing with a topic you touched on, Dr. Krupinski, so we'll start there. But both questions ask for a little more information about what exactly sensitivity and specificity mean, how that impacts usefulness of an AI model, and how leaders in healthcare organizations can really use that information to make informed decisions.
Yeah, so sensitivity and specificity are basically your true positive and false positive rates. So how often is the AI system actually finding and giving you the right information about what's there, the course of treatment or whatever, or is it presenting a false alarm? And so understanding those rates for a given AI system is going to help build confidence in the users and potentially whether or not you're going to buy a system. So a system that and you've got to balance it. So sometimes, having true positives is far more useful, and you can tolerate a relatively, high false positive rate as well. Sometimes you don't want false positives at such a high rate. So you kind of got to figure out what's the balance between how many false alarms basically are acceptable, because as your true positive rate increases, almost always the false positive does as well. So you got to find that balance. How good and at what cost is it going to be? And how you look at that again is that the company should provide that information. They have it. It's whether or not they provide it and how much they're willing to share.
Absolutely. Thank you so much for that clarification. If those who ask questions on this topic have any follow-ups, feel free to drop those follow-ups in the chat. Another question from our audience that looks like could really go towards both of you. Do you feel like the increased use of technology has had a hand in the increased number of people experiencing things like Alzheimer's or dementia with regards to some of the de-skilling concepts that you brought up, Dr. Krupinski?
That's a loaded question. I think there is de-skilling. There's absolutely zero evidence that I have ever seen that the use of AI leads to any increase in Alzheimer's or dementia. It's an interesting route to go down. And boy, I would be interested in seeing a study done on that. It's obviously a long-term type study. Jordan,
Yeah, no, I don't have the expertise to answer that. I'd say maybe more at the micro scale. I do think there's rising evidence that say that this has impact on our ability, our attention span, and our ability to learn and retain information over the long term. But whether those two things are linked and like whether actually associating it with disease state, I would not feel comfortable saying.
Yeah.
Absolutely. A couple other questions before we wrap up for the day. A couple people really wanting to know about where to start when thinking about adopting AI into their practices in a safe manner. A participant asked, ambient AI seems to be everywhere. Is that a good place to start to dip a toe in the water? Any other considerations or recommendations or concepts you want to revisit from your all's presentations?
I'll lead off, and Dr. Krupinski can correct me. No, I'm just joking.
I'll just add on.
I really think looking at that graph of that that Dr. Krupinski presented with the lower side of risk. So what we're actually seeing is AI is getting used a lot for administrative functions, and those are tasks. If we can automate them, it frees up resources, it frees up time, and there's very little potential for risk or harm to patients. So look for the easy wins, look for the things that are taking a lot of your time, but don't take a lot of your skilled time. So collecting insurance information, doing triage, doing check-in, things like that. Those are all things that potentially we could be using AI for, and that's a straightforward win. A lot of the other more like EHR medical record integrated things are probably have more risk, but could also free up more acute resources. So like providers and nurses and things like that. So that's my thought.
Yeah. Yeah, I agree 100% with that. And the only thing, once you get into some of those higher level ones, the higher risk ones, is to really, again, weigh the risks. What are the false alarm rates? What type of data were they trained on? And, to some extent, maybe start with easy things. I mean, computers are really good at, measuring things and counting things. So let it do that before you actually go into true clinical decision support. My advice there is, really look at the algorithms, look at the schemes, ask other people who have used them, other companies or other, healthcare institutions, and really as a user, make your own decision first, then ask the AI. Don't pop up the AI answer and say, oh, okay, yeah, that looks good, and do a brief examination of the data and hope, it's right, because you're already going to be biased. If you look at the AI first, it's going to guide you to whatever it thinks. So my best advice is always be an independent thinker and look at the data, then look at the AI.
Thank you both. Those are such great practical considerations for looking into how to really bring AI into practice. So on similar topics, we're seeing a few questions about the safety of different technologies, what EHR systems currently have AI applications or capabilities in them. I don't know that we're speaking to any specific products, but any insights you all can provide on sort of what are some safe options out there, what are potential vendors to consider, those kinds of things.
Yeah, I'll lead off on this one too. I I don't think we should discount the fact that there are AI systems being used all the time. So even right now, where we're sitting here, I've got a plane flying outside my window, and you probably don't hear that. And that's probably, in reality, that's due to AI. That's actually going through and doing the noise canceling and finding those that errant sound and eliminating it. So there are a lot of AI that's already being used in audio video. So if you're doing any kind of video, if you're doing any kind of motion tracking, anything like that, 90% of the time, that's all artificial intelligence, or there's some level of artificial intelligence. In terms of safe paths, I really hate to say this in some cases, but sometimes it's the best way. I think in a lot of ways, looking to what things might come bundled into our electronic health records. So, in terms of accessibility and things that are pre-vetted, that's a good way to look at it. So we'll see a lot more tools that are coming out through the medical records that we use, particularly for annotation, dictation, or doing summaries of medical records and things like that. If we're really risk averse, that might be one thing that we look at. If you are really less risk averse and you want to run ahead and find other solutions, there's a lot of other solutions out there, but I do think a lot of this will be coming in through the EMR platforms.
Yeah, I agree, and especially with the fact that there's so much going on in the background now, not just in healthcare, but everywhere that you're simply not aware of. So yeah, it is probably in every electronic medical device that's out there now, electronic stethoscopes. It is in every imaging machine. It's in the electronic microscopes. It is in an MRI, in a CT. It's in every cardiac device. I mean, so it's just out there and it's being used, and you're simply not aware of it because all these companies are utilizing it to create better technologies.
Absolutely. And both of you touched on risk, which is something we are getting a lot of questions about: risk, legal considerations, all of those kinds of things. So I do want to plug that some of our future upcoming sessions are going to be addressing in a very detailed manner legal risk, compliance considerations, all that good stuff. The session's titled "What You Don't Know Can Hurt You." So highly encourage anyone asking questions or just curious about those topics to attend that session. We are going to do one more question and then wrap up. So we had a question come in about how is AI influencing the design of patient engagement strategies? I know both of you engage with providers in a few different ways, and they want to make experience is good for their patients. Are you seeing AI influence design of patient engagement at this point?
I see it in apps. So for example, the whole role of avatars and that whole environment for interacting. So for example, in some of these websites where, especially for teens and young adults who are more comfortable opening up in an environment where there's avatars and they don't have to really show themselves, but they can reveal themselves through the avatar. And a lot of that is AI based. So that's just one application that I've seen that I think is really cool in terms of trying to engage patients better.
One that's been really interesting to me is the rise of these tools in the inpatient space. So our telehealth mandate's been really outpatient focused, but we're actually seeing a lot of tools built into the patient infotainment center, or with a capability to be built into the patient infotainment center to do virtual sitting, fall detection, risk for like bed sores and things like that. So all of that analysis can be done right from the platform, and then we can connect right to a provider who may not even be in the facility. So that's an interesting and compelling use for some of these technologies that I think a lot of organizations are redesigning their inpatient rooms to facilitate these kind of tools.
Those are both such great insights. And I'm so excited to hear from some of our future speakers at our upcoming sessions, diving into even more details about these applications in healthcare. So we are going to wrap up, and I just want to thank you both for everything you've provided to our audience today. Some really practical insights that I think lay an excellent foundation. As we wrap up, we invite everyone to participate in the end of session survey. Let us know if this was a good experience for you, so we can best meet your needs at future sessions. And while you're filling that out, I'm going to go into a little more depth about our upcoming sessions. So on July 11th, we'll have another virtual session with a speaker from Stanford. He's a very excellent, fascinating speaker. He's going to be talking about how AI is already transforming healthcare with some really excellent examples. And so we highly encourage you to attend that one. And later in July, July 23rd, we'll have our final fully virtual session. And we'll be going into additional examples of applications of AI in healthcare in specific care sites. We'll have a speaker from a large academic medical center, and we'll have a speaker from a much smaller, lower resourced provider in Hawaii. And so we'll be seeing how AI is being deployed in some very different contexts. In August, we're going to have our hybrid session, and that will consist of 4 separate sessions. And you can join us either in person in Los Angeles, California, or virtually. Those will be sessions covering things like legal risk, other foundational concepts for AI, and numerous other topics. It's an excellent panel of speakers, so highly encourage attendance there. Next slide, please. And with that, we are wrapped up for today. Thank you so much to everyone who's filling out the survey. I see responses rolling in. Thank you to our attendees, and thank you to our speakers. It's been a really excellent hour together, and hopefully we can recreate this in a few weeks at our next session. Thank you for joining us on this journey, and have a great rest of your day.